Today's guest is Danny Beales MP. Danny, can you tell us a bit more about your background and your role here in Parliament?
Sure, so I'm the MP for Uxbridge and South Ruislip in West London and a member of the Health and Social Care Committee.
Can you tell us more about the recent report that the Health and Social Care Committee that you sit on recently produced into adult social care?
Yeah, so we reviewed adult social care, particularly around the lens of the cost of inaction. So there's been lots of reports about what has to change in social care, the need for reform. So we didn't want to reinvent the wheel and go over that old ground, which is kind of well established. We wanted to look at some of the barriers to action that we've seen. Why haven't we reformed the social care system, and what are the costs of not acting rather than acting? Because we know changing the social care system, making it either free at the point of use or providing a lot more services costs money, and that's often the barrier. But what is the cost of not doing those things?
One of the criticisms of politicians is that previous governments' attempts to produce a long-term viable funding solution for both health and social care have been weaponised by opposition parties. So we saw this, for example, with Theresa May and the dementia tax. Why do you think that this government's attempts to fix the problem will be any different and will be successful in establishing cross-party consensus to address the issues?
I think quite clearly it's been a politically charged issue for many, many years. I think we heard about a number of different cases for reform that have happened from successive governments that have often kind of ran out of steam. Politics has been part of that, but also the kind of piecemeal nature of some of the changes that they've tweaked at the edges. The deal not, changes, for instance, slightly capping costs for some people, but not fundamentally dealing with the underlying kind of structure of the system and how it relates to the health system more broadly, or doesn't. I think the current government's approach is the right one, to look fundamentally at reform, to try and build a cross-party consensus, and I think that's going to be the crucial way forward.
Danny, housing is one of the key challenges that's seen as being a barrier to improving effective discharge from hospitals into the care sector. How can we fix this?
I think when we looked at the cost of inaction, that there is a bit of a burning platform. The social care system, the age and complex needs of our population is only going in one direction, and I think fundamentally we're not going to be able to achieve our other ambitions without social care reform, and those are the kind of cost of inaction we saw. We saw the fact that the work challenge, where getting people into work, keeping them in work longer, supporting people who are increasingly caring for people to stay in work. We have to fix social care. To fix our healthcare system, which is a key priority of the government, the 10-year plan, that can only be achieved really with social care reform alongside it. So a number of our social and political and economic issues fundamentally all come back, all roads lead back to social care reform.
How does the lack of housing impact the provision of social care in the country?
Yeah, well, our housing stock, the types of housing we need, the flexibility of housing are major challenges for people. Right from young people and families not having the right side accommodation, also to people with social care needs as well. We've heard about the lack of adaptability of housing stock, the fact that adaptations are very slow, getting kind of OT assessments, getting councils to invest in the changes needed to make homes suitable for people with extra needs of all ages. The system is really clunky and quite difficult. The interaction between health and care really doesn't work in the housing space. There's no incentives for the local authority to really invest. They don't necessarily reap those benefits of keeping people out of hospitals or keeping people out of more expensive care facilities. I think fundamentally both the kind of ability to refurbish, to invest in existing stock to make it more adaptable, but also kind of future-proofing new stock, make sure it's adaptable, it meets lifetime standards, that there's a good amount of wheelchair-accessible accommodation. All those things need to be kind of hardwired into our housing system. Yeah, there is a supply issue in the country. There's not enough homes of all sorts, whether it's the affordable tenure, it's homes for sale, or adaptable homes, kind of specialist facilities for people. Right across the spectrum in the country, we have a really significant housing challenge in terms of the right type and the right level of affordability of homes.
What's the best way for us to bring together some of the key decision makers that currently aren't included in part of the process, such as, for example, housing? How can we bring them more into the fold in order to help address some of these issues?
Well, I'm hopeful that the Casey review will look at this issue and look at integrating the system. I think the 10-year health plan is a real positive step forward for the health system, but it's particularly for the health system. So we're looking at the kind of evolution of ICBs at a local level, the kind of integrating health organisations, bringing the health system together. I think that's a really positive step for the health system, but the public health, the social care system and the broader determinants of health and care, they all sit separately to that. And I think there's a big question still for the next step beyond the 10-year health plan, how it's not just the kind of 10-year health plan over here and a social care system and a public health system over here. We have to fundamentally bring these things together. And I think that's work in evolution. I think there's hopefully in the Casey review that'll be something that we'll hear about a bit more.
One of the criticisms with regards to the Casey review is that it's simply going to report too late, and that by the time that the findings come out, there won't be enough time for the government to act upon them. What do you say to that?
Well, I think we've often fallen at the first hurdle of social care reform because it's been piecemeal, because there's been good intentions, some good initiatives, some good policies in isolation, but it hasn't fundamentally thought through the broader health and care system, how it relates and works together, how you build consensus about the funding of that. And so I think it's right to do it properly. I'm anxious for change like anyone else around social care, and our report, the Health Committee, shown the need to act financially as well as socially and morally. But I think you need to get it right. I have personally, the committee heard from Baroness Casey, and we've met her. I'm very confident in her ability to deliver significant issues as she has before in a number of areas. And I would say I don't believe that she's only going to recommend things in a number of years. I believe she's keen to move forward with a series of stages of her review.
The criticism has been less on Baroness Casey, but more simply on the timings of the delivery of her reports.
I can recognise those challenges. I'm keen as much as anyone for action on social care. And there's that moral, financial imperative. But there isn't a Casey plan ready to go now. That's the challenge, right? If there was an off-the-shelf fundamental reform of the whole health and care system that someone had ready to go, they'd have produced it. Well, certainly we haven't seen it at the Health Committee. I think there's lots of ideas, but there's not fundamentally one consensus about the way forward. And we've tried before to do piecemeal things, cap this, a slight incentive here, a fund over there. We could do any of that. And there is good work already happening around pay for, the fair pay for people in social care, lots of kind of positive investments in social care. There are things already happening, but the fundamentals of changing and reforming the system, I do think you have to get right. Because, a reform slightly later is much better than an abortive attempt that doesn't lead to anything in 5 to 10 years. And I would say that Casey, from what I've heard and what the committee's heard, is keen not just to wait until the end of her review to report, but to put forward a series of recommendations almost as she goes, as she believes it's suitable. So hopefully there'll be things sooner than the end of her review period to act on.
Obviously, many of the issues that we're talking about with regards to both health and social care come down to long-term funding solutions. Do you think that funding should be taken away from local authorities and centralised in the same way that we've heard reports of the idea of a national care service is similar in parallel to the national health service? Do you think that centralising funding is the key to solving the issues?
Yeah, there are a number of different options around funding and the way the future could look. I don't think there's one answer. I think there are options. Clearly, at the moment, I would say we're already spending quite a lot of money, but we're spending it quite poorly. And that's what the committee found. And there are ways of not necessarily spending huge amounts, but trying to spend it better. I recently met my trust and my ICB, and around 4 in 10 of hospital beds are those who are severely frail. About 60% of healthcare costs is around 6% of the population. And so working the system better, making that money work better for patients, for people, I think is definitely a way forward. I think there's ways that we could blur the boundaries, these silos that have appeared in the social care system, the public health system, the health system, bringing budgets together. The Better Care Fund does a bit of that, but I think there's a lot more opportunity to use the existing money we have better. And certainly, whether in future, the commissioners of social care and health integrate, work differently, or one, or a new body. I think all of those things need to be on the table. And I think those are exactly the things that Baroness Casey has to consider, and I'm sure will.
Beyond funding, what do you think are the key solutions in order to being able to improve preventative healthcare provision within the community?
I think at the moment the system is far too siloed, far too complex. I think the incentives, the financial flows just work against the direction of travel that we want to see, which is integrated health and care around the person in their best interests, intervening as early as possible. And at the moment, the whole system is set up in a way that doesn't enable that. You get support when you're the most ill, or you get care when you're in most need rather than in less need. And the whole system, in terms of investing early in those adaptations at home, getting care at home from the local authority, the benefits of that, which would be that extra bed day, perhaps prevented, or admission or call out, none of that flows to the person who has to pay for that. So I think fundamentally changing that, changing those incentives, those financial flows, trying to bring together and encourage collaboration in the system is crucial.
In Uxbridge, your constituency, and across constituencies all across the country, there's still this postcode lottery in terms of care provision. What needs to take place to make it more unified and consistent?
I think the whole health and care system, the whole state really has to focus on equity, and that isn't just about providing a standard service to everyone. Equal service. It's about really working out who's locked out from care, where it is most need in your community, and focusing intervention on that. So I think, for example, in my own patch, I've met the health and care system who are coming together around 3 new neighbourhood hubs. They're seeking to base those in key communities where access needs are greatest, where deprivation is greatest, particularly in the south of the constituency, making sure extra support and resources go in. And I think that's exactly the sort of approach that we want to see from the state at all levels. Is kind of progressive universalism, is of course services, the NHS for all, but fundamentally a particular focus of funding on the communities that are currently locked out or not getting the services that they need. The GPs, the hospital trust, the community and mental health trusts, the local authority and the voluntary sector have all come together and are very much in the spirit of the 10-year health plan, are seeking to establish 3 neighbourhood health hubs in the north, centre and the south of the borough, 3 hubs which bring together a range of services beyond just your general practice. One of them is going live in pilot form this month in October in Ruislip Manor, and we hope that the second one in Uxbridge will come shortly after, and the third in the south of the borough, somewhere around Hayes. Fundamentally key will be funding, particularly capital funding, buildings and infrastructure needed to support them. But there's a real commitment across the whole health and care system in Hillingdon to work in that way, which I'm really pleased about and supporting. And the government have made it a pilot site for neighbourhood health, announced in the last couple of weeks.
Wes Streeting has a perception above many of his colleagues as being among the most kind of dynamic and the most able to take some of the difficult decisions that are necessary in order to tackle some of the problems faced by health and social care. Why do you agree with that? Why do you think that is?
I mean, I think he is a kind of dynamic, kind of passionate kind of politician who I think has a really strong record of delivering already. He's advocated for a really positive outcome for health and the health system in terms of spending, big increase in spending for the NHS despite difficult financial times, which is positive. And I think if the way he's structured about changing the system, I think is the right one. As well as spending, we need to fundamentally reform a lot of public services, and I think he gets that, and he's passionate about public sector reform. And so I think he understands the system well. He's passionate about change. And he's also passionate, in a way, about working with people to do that. I think he's built much more positive relationships with health and care professionals than predecessors had, which is good, and really respects them and sees them as part of the solution. And I think, unfortunately, previous government often blamed those in the system for the system's failings rather than realising actually it's a shared endeavour to fix public services. The user of public services has to be at the centre and they're part of the solution, but so are those who provide the services. And I think, unfortunately, it became very adversarial, particularly at the end of the last government.
And lastly, what are some of the lessons you've learned from local government that you're bringing to your role here as an MP in Parliament?
Working in local government, I think you're on the ground very much. You're really, working with people who provide services, who use services directly. You're hearing from them. I think services have to be very kind of user focused. I think often the service can retreat. It can become quite defensive. It can become based on how the service is provided, not what the user of the service needs. And I think that's a lesson I always take away from my time in local government. I think devolution is vital. Like, the services, things should be delivered as close to the ground as possible, decisions to be made as close to the ground as possible, and we're still far too centralised in this country compared to many, and we need to devolve power, devolve resources as much as possible, and collaboration. And in my experience in local government, one organisation never has all the levers or resources it needs, and that could become a barrier to change. But actually, if you flip that on the head and say, well, who else has levers to change? Who else can we work with to solve this problem? You can unleash so much more change and potential. So you should always seek to collaborate. Even if it's difficult, even if you disagree, collaboration is always the way forward, rather than just organisationally retreating to your silos.